Hi there, this is Sam, 6 months on tea. I'm feeling pretty pissed off, to be perfectly honest. But I'll start with the okay, I've been back at Leeds for a few weeks. It seems since then, or since even staying with Mum, I seem to be passing less these days rather than more. There was that incident in the charity shop I mentioned. Come back to Leeds about a week or so and get approached by this guy when I'm out shopping, going like, "Are you a woman?" Since then, there was this time at church this Sunday just gone. I was just exchanging names over coffee, and she takes Sam to be short for Samantha. On top of that, there was the next day. I've been going to this other church for a while. It's like really all-inclusive church, so like I can say I'm gay, bi, or whatever, and they have no issue with it. But on Monday I was having a bit of a whine about not being able to do as much yet. One of the guys goes, "Don't run before you can walk, girl." Yeah, thankfully I wasn't the only one who corrected him, but still, that got to me a bit, on top of everything else. Then, today, I'd gone out to, well, I'll get to my haircut in a minute. Obviously, actually gone out and got it cut now, thankfully. But anyway, before I get to the haircut, because that's the latest thing, I had my blood test on Friday. It's just last Friday, it's 15th. So I got my blood test back today, which I've got printed out here. I'm actually starting to wonder how they've gone about the testing, like even in the first 3 months after starting hormones, let alone now. But I mean, they were saying my T levels were on the higher end of normal. Although last time I checked, this is according to Dr. Curtis, a normal guy's, well, cis guy's normal guy's levels are about between 30 and 60. So them saying upper end of normal, I'm just I don't know. But anyway, I got my blood test results back today when I phoned. The nurse was saying that my levels were raised, so I was like, yeah, okay, what is it? She goes 11 and a half. So I was just sat on the phone and I was like, that means my levels have dropped since I was last tested, which really pissed me off. I don't know what got to me more, just the fact that my levels have dropped post-histo, which is pretty weird in itself, or the fact that it seems that I got tested as a female, which is confirmed in these results here. So I had 3 tests done. There's what they call FSH, like follicle stimulating hormone, whatever that is. Result 86.5. I don't know if that's normal or not. Underneath it goes female follicular and luteal phases, whatever that is. Then you've got the LH. I don't know if that's still abnormal or not. And testosterone level normality above range. Result 11.2. Bearing in mind I was 30.4 last time. So 11.2. Underneath, testosterone by TMS, whatever that is, should be considered to be significantly elevated at values like greater than 4. I guess that they're saying my levels are 4 times the normal range for a woman, as it says here. Female reference ranges based on da 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 da. Yeah. So I have been tested as a female, despite Mr. Samuel Gocher being on the papers. So, according to those test results, I have abnormally high testosterone levels. According to my results, I am lower than I should be, which has also pissed me off. So, when I talk to the gender clinic guys next Tuesday now, I'll have to ask, like, should I now be putting on 2 sachets a day instead of 1, or do I have to go on libido or something like that? So there's that, and then there's the hair. Now I've been going to a barber's for a while. I started going sometime before I went back to my mum's place. While I was at my mum's place, there was this unisex hairdressers. Bearing in mind this is a small town, when it's this unisex hairdressers, where it's £6 for women's haircuts, £5 for men's haircuts, which is what I pay at the moment. So I went into this unisex place, had this great talk about my hair and how short did I want it, how did I want to wear the top. Charged me £5 at the end of it, which was great. Asked for flying colours. Come back to Leeds. Go and get my hair cut today finally. Noticed he'd feathered the hair like along the top, like little fringe or whatever, which I thought was odd. And then I pay him the £5, and then he goes, "Goodbye, love." So all this time I've been going to the barbers, they've thought I was a girl going in for a masculine haircut. Yeah, I've had a bad few days. I am not happy at all. I'm hoping that now I've got my hair cut, I will pass a bit more, but that's not making me feel much better at the moment. I had to slip back my hair on the way out when I left the barber's. When I was leaving for the barber's, I went out the back way where these kids hang out sometimes. Little girl, like none of them had seen me before, but little girl, she's about 4 years old or something like that, asked me to take the sunglasses off, and I noticed she was staring at me. My housemate's in, so anyway. She asked me to take the sunglasses off for some reason, and she just stared and stared and stared. And the older girl that was there, asking her what she was doing, explained to me, like, "Oh, she'd never seen you before." I was like, "Yeah, okay." Went on my way. She was still staring intently at me, and I have this funny feeling it's because she's trying to figure out if I was a guy or a girl. Yeah. So, despite the fact that my voice is finally breaking, and nice hairy arms now, which I've had for a while, and the parasite's gone, I'm actually feeling pretty low at the moment. Yeah. If I start gelling my hair again, I don't know if that's going to make any difference to getting misgendered, or well, do it more to make myself feel better, to be honest. But I don't know. Just need to get off my chest at the moment, but I shall certainly be having a good old rant to the guys at the gender clinic next week. So yeah, hopefully next week I'll have a bit of a more hopeful, positive video. But in the meantime, happy Easter, guys. See you later.